How does the USA health system work? The healthcare is the United States is organized by complex bureaucracy, while in the rest of the world. While the rest of the world healthcare facilities are owned mostly by the governments by a private sector businessman, in the US a large share of hospitals and clinics are owned by the private non-profit organizations. Yet the United States is the country that has the highest healthcare execution in the world. While these expenditures are covered in a large share by public payers as by federal institutions or state and local governments, they can also covered by private insurance and individual payments. At the same time, unlike most developed nations, the US health system does not provide health care to its entire population. As there is no signal national-wide system of health insurance, the United States primarily relies on employees who voluntarily provide health insurance coverage to their employees and dependents. In addition, the government has programs that tend to cover healthcare expenses for the fragile of parts of the society as the elderly, disabled, and the poor. These programs differ from one another and all have a specific kind of people that are subjects to. Getting health insurance in the US is not as an easy thing. Someone may think that once you have money, everything is easy peasy. But in fact, things are a bit more complicated. One must be very careful and look out to pick the right insurance. Health insurance in the United States for non-citizens. The United States government does not provide health insurance for all peoples. Health insurance is not obligatory for the these living in the USA. It is optional but highly recommended and necessary since health services are very costly. More than in the other country anywhere across the globe. There are two types of health insurance in US, private and public. Most people use a combination of both. The US have public health insurance and Medicare, Medicaid and children health insurance program. The USA has the most expensive healthcare in the world. That's are getting educate health insurance cover comes highly recommended. You can get a free health insurance quite initially by clicking not my Medicare is an nationalized health insurance program that dates back to 1996. They provide health insurance for the US national older than 65 year old but also for the younger people with the with end stage renal disease and ALS and some other disabilities. Data shows that in 2018 Medicare provided almost 16 million individuals with healthcare in the US, over 51 million of which were older than 65. The Medicare program is divided into four parts. Part A, which covers hospital, skilled nursing, and hospice services. Part B covers outpatient services, including some provided services, while inpatient at a hospital. Outpatient hospital charges. Part C is an alternative called managed Medicare. A and B are often the benefit of the Part D and annual out of the pocket spend limit with the A and B leg. The sign is the part most sign in a Part A and B first. If Part D covers mostly self-administration participation drug. Medicaid is a federal and state program that helps people with the limited income and resources to cover Medicaid cost while covering benefits normally not covered by Medicare as nursing home care and personal car services. It is the largest source of funding that medical and health related services for people with low income in the United States. Data shows that the US provide health insurance to 71 million people with the low income in disabilities, which is 23 of total of the US population. Children Health Insurance Program, formerly known as the State Children Health Insurance Program (SCHIP). This is a program that covers with the health insurance children for the formality of the mindset income that are too that are not low enough to qualify for Medicare. Goodbye to from this video. Thanks you for watching, and we will meet in another video.